I'm Dr. Athena Paradise, and I want to talk to you about low back pain. Low back pain, I think everyone I know has experienced that at some time or another. Erchonia did a 2-year double-blind placebo-controlled study on low back pain and treatment with the low-level laser. So on average, participants had low back pain for over 8 years. So this was chronic, terrible low back pain. They only used the Erchonia laser. People didn't get any other treatments, no narcotics, no chiropractic, no nothing else. Every patient continued to improve well after the end of the treatments, and no adverse events were reported during the study for the treatment group. So this is great news. The reason it's great news is that the World Health Organization put out guidelines in 2019 talking about what is a viable solution for the allopathic community that's safe, cost-effective, researched, and can be a low maintenance experience for patients where they're not having to go to surgery, recover from surgery, something very easy. And what they said is, it's not NSAIDs, it's not opiates, it's not steroid injections, it's not spinal surgery or fusions, it's not radio frequency denervation, and it's not Lyrica or Neurontin. What they said is the first thing that should be done is low-level laser therapy and physical therapy, that those were the two most effective things. Both of those are pretty non-invasive and very successful. Low back pain is debilitating. When, the few times I've had it, it just takes you down. You can't do anything. No matter what you try and do, depending on the level of low back pain, it's either annoying or a searing pain, and it affects everything. It affects your ability to work, it affects your ability to interact with your family, and to just think. Pain is so overwhelming. And so anything that can help change that is really important. So some of the conclusions from the World Health Organization low back guidelines, the biggest one was that every year health systems waste billions of dollars on unnecessary tests and treatments for low back pain. And who's paying for that? We are, through our insurance premiums that keep going up. Billions of dollars on unnecessary tests and treatments. Neurontin and Lyrica are a death sentence for new brain synapses. So it's always so frustrating for me when I do something that I think is supposed to help me, and then I find out it's actually harming me. And one nice thing about laser treatments, they're not going to hurt you. There's never been any reported negative side effect. So it's a very safe, non-invasive treatment. The other things I love to do for low back pain, I'm a yoga teacher and I work with Iyengar Yoga. So doing rehabilitation so your muscles get strong, so you're not susceptible to having low back pain once you're feeling better. There are very clear things you can do to help heal your low back pain and really reduce the chances of it reoccurring. So don't sit and suffer with low back pain. Get some help. And please explore low-level laser therapy, chiropractic, physical therapy before you take any more dramatic actions that really have not been shown to be successful. The NSAID, the Advils and all of the drugs, the steroids, the surgeries have a very poor success rate. So one important detail that's been shown very clearly in research is that only lasers can be used for low-level laser therapy. In all of the research that's been done on low-level laser therapy, LED lights have been used as the placebo. And so that's not an effective option. That's not an alternative to lasers. LEDs are used as the sham, and it's been shown that those do not have the same effect as a low-level laser therapy. So please make sure you're getting low-level laser therapy, 635 nanometers wavelength, and that's what you're treating with.